Hello and welcome to the Great Big Indian Wellness Show 2021. My name's Tony Patty, and joining me today is a very, very special person whose name is Ranjan Amin. And Ranjan Amin is an Ayurvedic practitioner from Ayurvedic Health London. I'll tell you more about Ranjan in just a few moments' time. And today's masterclass is all about managing long-term COVID through Ayurveda. Have you heard of such a thing? Well, today we're going to be learning all about that with Ranjan. So as we come through the pandemic, the efforts of long COVID have been hit by many. Memory loss, shortness of breath, chest pains to extreme tiredness, rashes, and also sleeping difficulties, to name a few. So how can we use Ayurveda to help manage these effects? We're going to be learning all about that. And Ranjan Amin is with us today, who, as I said, is an Ayurvedic practitioner from Ayurvedic Health London. As far as Ranjan Amin is concerned, she's been a practitioner of Ayurveda for over 10 years, based in London, treating a whole range of illnesses, including COVID-19 recovery. Now, Ranjan uses the principles of Ayurvedic medicine to manage type 2 diabetes, digestion, IBS, and other gut problems as well. And by combining gentle Ayurvedic foods and herbs, which includes meditation, yoga, together with establishing Ayurvedic lifestyles and other things that go along with it, Ayurvedic Health London further makes it possible for patients to reduce and recover from COVID-19, with a focus on managing long-term COVID through Ayurveda. And I must admit, to me, it was something very, very new to learn about and to hear about. Managing COVID through Ayurveda, very new. So to tell us all about that here today is Ranjan Amin, as I said, who is an Ayurvedic practitioner. Ranjan, a very warm welcome to you, and thank you for joining us here today on the Great Big Indian Wellness Show.
Hello, Tony. Thank you very much. I will do my best to help many people as I can. And it's a shame that COVID had to come in the way it did and how it's affected people. So my aim still is and always will be to help them in as many ways as I can, alongside any of the medical tablets or medicines that they're taking. So let's get on with the show then.
Thank you very much indeed. It's a term that I must admit I'm not very used to, have not heard of before, and that is a long-term COVID. What's that all about, Ranjan?
Well, it's new, and primarily it's been around probably, the recovery of COVID should for most people be around 3 to 6 months or less. For instance, some of my patients who got COVID, who contracted the virus, they had very few symptoms, and they weren't the symptoms that the government had put online. Some of them had pain in the bones, pain in the digestive system. Very few had breathing issues. And I myself, when I had it, I had a problem with my knees, and I had lost my taste. And that was the first signal I had that I had actually, contracted COVID. So the initial symptoms are very, very different for individuals, and it's very hard for one to know. You could just have sneezing and runny nose, and you'd think it's a flu or cold. But in fact, that was for many a beginning of the virus contracting into the body. So further along the line, as I said, recovery for some was quick, for many it was a little bit longer. And for others, long-term COVID has meant that some of the symptoms related to the virus has continued, and there is a very reduced level of recovery. So this is where the long-term COVID has come about, the actual slogan. But what in fact it is, for many of my patients, this was something that we saw all at different levels. It was at different stages. And one of the key things we realized very quickly was that recovery was happening for individuals in their own pace, depending on whether they had other issues, other medical aspects that were contributing to lack of recovery. So it's not always the COVID-19 virus, the actual attack of it on the body, but then it could be a whole combination of whatever other diseases or aspects of ill health you had that contribute to that recovery. And so this is where the long-term COVID has come about, that people are still, after 18 to 20 months, are still not recovering at all.
You've explained that very well, Ranjan, and the time it takes to recover from COVID-19 is different from everybody, as we've just learnt from yourself. People feel better in a few days or weeks, and most will make a full recovery within, say, 12 weeks. But for some people, symptoms can last longer. So the chances of having long-term symptoms doesn't seem to be linked to how ill you are when you first get COVID-19. And people who had mild symptoms in the first place can still have long-term problems. And it is those people essentially that we really need to talk about today. Am I right, Ranjan?
Yes, absolutely. So, what is it that's triggering the lack of recovery? What is it that's contributing to my not becoming well? What are the areas I need to be addressing? Are they only to do with medicines, or is there other areas I need to be looking at? This is what we found with our patients, that we had to look at multitasking areas. We had several 6 to 8 areas to look at in different individuals for recovery.
So looking at it from the Ayurvedic perspective and treating people, you mentioned some symptoms of long COVID, which we've established what it is: extreme tiredness, shortness of breath, chest pains, difficulty sleeping, heart palpitations, dizziness, pins and needles, joint pain, knee problems, earaches, feeling sick, and high temperature, rashes. The list goes on, doesn't it, really? So from an Ayurvedic perspective, can these illnesses be treated?
So in Ayurveda, we address the whole aspect of the illness of the person in a very different way. It's taking the whole person as they are. We're not really looking at just symptoms or what you've just described. We're looking at to see where is the problem coming from? How did it manifest into the body? So one of the things you said earlier was that when there's weakness already in the body, then the virus is attacking you. So it could be that weakness could be that you had already, like I had diabetes too. And some of the other patients I looked at also had diabetes too. But all of us are at different levels, different stages. Some are on medication. I was never on medication. So we all had this slight area of weakness in our body. Every single individual will have a weakness somewhere, whereby it starts to become inflamed, or there's another aspect. They could start to create pain, or it could be high levels of stress that creates the weakness. So it's not always disease. So in Ayurveda, as I said, we look at the person, and we will look at whether that person, what age the group they're in, where they're living, how they're living, their lifestyle, what are the other medications that they're taking, what are the other illnesses do they have, how was that being managed before they got COVID, and how are we looking at the person as they are now with COVID and trying to recover. So we would look at first their Prakruti, we would look at their Vikruti. Prakruti is looking at the dosa of the person, Vata, Pitta, and Kapha. So we have the 5 elements within the whole of the environment, the galaxy: air, water, earth, ether, and fire. And so our bodies are made up of these 5 elements. And so we can say that Vata is air and space. And when that increases, one of the techniques I want to talk to you today about healing long-term COVID is Rasayana. And Rasayana was being used as a therapy to actually promote anti-aging before we knew it. So 5,000 years back, people were using Rasayana to actually live long lives. Then you can say that after that period, they were using it to manage their illnesses and have long life by recovering from these illnesses, or rejuvenating, or rebuilding their body. So Ayurveda looks at the combination of the 5 elements of air, water, earth, ether, and fire in your body and brings balance back. So Pitta would be fire and water, and Kapha is earth and water. So these are very, very opposing elements in our body. And we can say that long COVID, because it's the upper half, lungs and chest that's affected, your taste, your 5 senses are affected. Some people had affected in their ears and their eyesight was affected. So we can say it's Kapha, which sits here in the top half of the body, and the Pitta would sit in the middle part, which is the digestive area, and Vata sits in the abdomen. Now we can say that the long COVID for many people would have been a combination of Vata and Kapha, with a very heavy disturbance in Pitta, which is the digestive system. So first of all, we can't breathe very well, we become anxious, we lose energy, vitality, and we stop eating, maybe we start to get vomiting. And so the inflammation in the body is beginning to increase. And generally, and very specifically, it would be in the digestion, but very specifically in Ayurveda, we would say that the Agni is affected. The Agni is the fire within the stomach that actually increases that fire, so food gets absorbed. Now, what is happening in long COVID is that food remains not absorbed properly, so it's malabsorbed. So toxins start to form, and then they are circulating in the body. And as this happens, so inflammation is growing more and more, and we lose that very high level of balance that we had prior to COVID. And that balance is reducing. The balance between Vata, Pitta, and Kapha is no longer there. And so one of the things that we did with our patients was sleep, managing the sleep. They had great difficulty in sleeping because there was anxiety, there was fear, and there was also all the body different dysfunctions taking place. One of them might have been high fever, and the other one may be vomiting with high fever or diarrhea as well. So, and what can we do for the patient first to get the sleep right? So in Ayurveda, we would normally, under normal circumstances, where I've seen the patient face to face and I can take their pulse, I can diagnose how they are inside the body and what has been disrupted. Now, this is COVID, we're in lockdown, I'm speaking to people on the phone. And so how is it possible to
establish all these elements? Yes.
Exactly. Yeah. So I had to really just tune in a very powerful way to what were they describing when I asked them a question. How do you feel now? When they explained to me, I have to pick up the different threads of what they were explaining to me. And one of the key things was that they were not sleeping well, they were dehydrated, and that most of them had very high fever. So Jwara is what we call high fever, and it is really well known and well treated under Ayurveda. So one of the things we do is take them off all the foods And we start only to bring that temperature down by keeping their body temperatures at a lower level, using water or ice, wet cloths. And also, we didn't actually use any herbs. We just used fusion of tea. The first tea we gave them was tulsi and turmeric and ginger, tulsi, turmeric, and ginger teas. And we had packets already, from organic India. And so we sent these across to wherever they were. We also made juices for them, very specific, with turmeric, tricketu, and triphala, and aloe vera juice. I had only 2 bottles of aloe vera juice, and we used to just put 5 ml in each of the drinks. But it works, because one of the things we're looking to do for these patients is not just the fever, but we also want to get the digestive system stable, and to bring some level of small quantities of food going in on a regular basis. And that food was always liquid. Initially, for the first 5 to 6 weeks, we only gave them in liquid form, either in soups or juices, and they were always vegetable juice. So we didn't give them much solid food because they were not able to take it. But we saw recovery, particularly through some of the, we can call them tisanes, or infusion of herbal teas. And these are not ordinary teas. These are medicated teas in very many ways. The organic India and pucca teas are really well constructed, and you're able to absorb the nutrition that's in there, or the ability of turmeric to become anti-inflammatory into your body is something that is not really well understood. It's not, you just can't put half a teaspoon of turmeric in water and start drinking it, because it's not going to absorb. The curcumin, which is the part within turmeric that allows inflammation to reduce, has to be absorbed. Now, the main thing here is you'd have to take black pepper. We always give them tricketu, which is a 3 herbs. So it's black pepper, long pepper, and another ginger. So these 3 are measured in quantities for it to become tricketu. And these are very old traditional herbs that the sages used to use. And then the actual constituency and the actual measurement of that is still as it was then. So if they're measured in the way that they have, which is 1 to 1 to 1, triphala is done the same way. So for instance, if you use 1/4 teaspoon of ginger, black pepper, and forgotten the other one. I've forgotten the other herb.
Well, there was long pepper, there was pepper.
Long pepper, that's right, long pepper. So these 3 would have to be in equal quantities. And this is how it's measured. Now, for some patients, this can be very heating, especially if they've got a lot of heat in the liver. And this would heat up the liver very quickly. And with fever, this is what is in existence. So you've got the heat from the stomach, but it's 3 times more in the liver. The liver has 3 fires. And so these fires will be contributing to the fever. And so we need to cool that. So this is where we would have put in aloe vera juice. And we also added things like, I can't remember the name of it now, but we would have added also another herb that was cooling, gudichi, that's right. So gudichi is another very, very powerful herb to help the liver function. So we're not always looking at the lungs in COVID with breathing difficulties. We're looking at how to get the digestive system fired and working to some balance, and also the liver. And we're also checking the breathing. So as the stomach starts to heal, and there is a very deep connection, nervous system connection between digestion that's occurring in the stomach, and then the link to the brain. So we call this the gut-brain link, and that link is called the enteric nervous system. Now that system has the ability, so as you improve the digestion, this is the key principle of Ayurveda, is improve digestion first. Make sure they can absorb the food. Without absorption, you're not going to get any level of healing. So this is one of the first stages that we will deal with long COVID.
Very interesting indeed, Ranjan. Thank you for sharing those wonderful techniques and managing the symptoms. So, as I say, such an informative piece and so much to learn from that. Ranjan, you are a Ayurvedic practitioner right here with us today on the Great Big Indian Wellness Show. As far as Ayurvedic techniques are concerned, you've talked about herbal teas to boost immunity to COVID. Are there any other tips that you can give us today that we could possibly employ to help us beat COVID and also help to manage long-term COVID, is what we've been talking about today in the program?
Yeah. So the Rasayana techniques or therapies that I was talking to you about, Rasa is looking at the blood, good blood flow, and Yana is the path or the essence, the path to really good building essence of a body. So it's the absolute balance that we could come to maintain. So Rasayana introduces firstly the sleep, a routine. It introduces a routine, and we call it dinacharya. And so dinacharya is getting up on time and going to bed on time. This is very, very important for patients who are recovering from long-term COVID, because day and night get confused. They've been in a state of fever, and they've been in a state of, an inflamed body for a couple of weeks. And now they need to try and get back to some, what we call a rhythm, circadian rhythm, which is go to sleep on time, wake up on time every single day. Now, this helps to reestablish the rhythm of the body.
Yeah.
And it reestablishes night and day in the body. And it reestablishes a pattern of healing, which is very important in Rasayana. So if I'm to recover from anything, I have to have this discipline. So that's the first thing. So go to bed on time and switch off all the electrics. Do not keep any electronics on, your mobile and your laptop. You probably won't feel up to it anyway. So switch them off and just try and redo a yoga nidra. Just close your eyes and use meditation. Now, some of the meditation techniques I've used on myself and as well as other patients and friends and family, especially, during they've had the vaccine and they felt quite rough. So they spent time in reflection or just sitting in silence and looking out at nice flowers, or it might be looking at the blue sky. You're not thinking. Even in long COVID, the ability to think is not necessarily there. You're just feeling many things and probably a state of confusion often. So you want to get your mind relaxed. One of the ways to do that is to just bring some level of stillness and try and maintain some level of positivity. So, I am peace is a very good sentence to start with. I am peace. Every now and again, go back into that thought that I am peace. And I want that peace to instill into my body.
For what you've shared with us here today has been absolutely riveting. So thank you so much for your very kind time, Ranjan. It's been a pleasure.
Thank you, Tony.
It's been a pleasure and a privilege. Thank you so much.
Thank you. It was an honor, and thank you very much.